everyone. Thank you so much for joining us. Hi, Gillian.
Hi, Anae. How are you this morning?
I'm doing really well, thanks. How are you?
Yeah, not bad, not bad. It's a nice spring day here in the UK.
Oh, lovely. So nice to have the weather turning and getting warmer. It's the other way here. We're getting a little bit colder every day.
But you probably don't get as cold as we do you?
No, not at all.
No.
No snow. No snow.
It's still 2 degrees outside.
Oh my goodness. No. We don't get that cold except in very specific areas, like where it's really low. Otherwise, we have nice, kind of the coldest we get is probably around 10, 15 degrees in the day. Uh, So hello to everyone who's joined us live. I see there are a few of you with us. Please give me a thumbs up. Let us know where you are in the world, and also let us know if you can hear us and see us clearly. I know my internet connection's not fantastic, so I'm a bit fuzzy, but if you can hear me, that's all you need. Yeah, that's all that's important. So let us know in the comments who you are, where you are, if you can hear us. If there are any issues, then we can try and address that before we get started. Gillian is here with us today to chat about an area that she's really passionate about. If you're on her Facebook page, you'll see that she's speaking about it really often. So I'm very excited to dive into it with her. And yeah, I mean, it's something that's really important to all of us, right? Core strengthening, postural support, postural retraining. That's something that we're dealing with basically in every patient. So if you have any questions at any point, please put them in the comments and we'll address them. We'll chat about them. Hi, Alison. Thanks so much for joining us and letting us know that you can hear us. Let us know who you guys are. There are quite a few viewers live. So where are you guys? What are you doing? And what are your questions for Gillian? Gillian, as we get started, will you please tell us a little bit about yourself, what you do, and your connection to equine core strengthening?
Yes. Well, I'm really grateful to be invited to come and talk to you guys. And as Anae said, any questions, pop them in the chat, and we can try and answer them as we go along. So I am a physiotherapist. I started quite a few years ago. I've actually been working for over 2 decades. I started out as a human physio, but always knew that I wanted to go into treating horses because I had my pony treated when I was very young, and I thought, oh, that's really clever. I want to do that. So very fortunately, I followed a pathway through human physio because I'm that old that was the only option at the time. So I did that, and then went to the Royal Vet College, and I did my master's in veterinary physiotherapy there with Dr. Kathy McGowan, who was running the program at the time. And then I was in mixed practice for a number of years, and then gradually sort of reduced the numbers of dogs that I saw and the number of people that I see, and then went full-time into equine practice 16 years ago now. I absolutely love my job, and I was asked to share some of my knowledge and started teaching, and that actually then evolved into a full teaching role, although it's part-time. But I now work at Hartbury University. I'm the program manager for the Masters in Veterinary Physiotherapy there. So I think this is my 9th cohort of students that I've been working with there. And as part of that, I have undertaken some research, which actually is sort of specifically on this topic, and completed my doctorate last year. So I am now Dr. Gillian Tabor, and hope to literally just carry on. I've sort of just started, and now I am like full power into teaching and researching, but not forgetting my clients down here, my lovely clients that I see with my own practice as well. So that's who I am. Oh, and if you've seen any of my social media posts and they asked me about him, you'll see my own horses as well, and my special baby Leader, who is the brown, rapidly going grey Lusitano, who is used as my model for all my posts as well.
I love it. We have a comment here from Eloise saying that your social media posts have been great recently, and I must second that. It's social media is one of the biggest ways that we reach our clients. And it's fantastic to see the example that you set and the ideas. And I know that it gets, my brain turning of some of the things that I could do to get some more engagement on social media and reach a broader audience. So, well done. You're doing a great job.
Well, social media is not my forte. I mean, sort of my why really is trying to share what I've learned, and I am still learning, and get it out there to other therapists and actually to owners. And that's what's really exciting when I see people share the pictures on their group, and I know that then their clients are then seeing them. And I think it's just trying to share a sort of unified, evidence-informed message. And so that's really nice to know that people do like them, and I will keep going. I've got lots more plans.
Good. I'm so glad. So let's jump into our topic. If at any point, guys, pop a question in the comments and we'll address that. So feel free to interrupt us, or just let us know your thoughts and your experience. That's also very welcome. Let's have a discussion and a chat. So Gillian's not the only one who knows about core strength and posture. You guys also know something, so please do share so that we can learn from each other. So let's start with the why, right? Why is core strength so important in our patients?
Well, I think there's really sort of two avenues I could take that. One of them is in the supposedly normal, clinically normal performance, and I talk about horses now. The core strength is really I see it as like the link between their body and their movement. So if they don't have core strength, how are we ever going to have good quality movement? So from a performance point of view, we want to ensure that we can control the movement. We can actually then build up in the requirement for what we need to do. So horses, they're really, really quite simple in their movement when they're out in the field by themselves, but then we're quite demanding of them. So we need to have that strength to be able to support firstly the rider and then the specific movements that we ask them for. And then the other side of the coin is obviously those horses that aren't clinically normal. And then when we've got pain and we've got altered movement, and this is actually where I can be quite evidence informed, because we have got so much literature now. I think we're sort of not under any illusion what effect pain has on the body. We know, multifidus wastes away. We've got multifidus atrophy when we've got osseous pathology in the spine. We know that from a sort of a wealth of research from Dr. Stubbs. But now we've got Dr. Rombach talking about longus coeli atrophy as well when we've got osseous pathology. And these deep postural stabilizers that are affected when we have got pain are then needing to be affected when we're trying to resolve our issues later on. So I think that link between core stability, performance and pain is just this sort of triad that us as therapists have got to really, really address. And then, the link between that and posture, well, that's a little bit more tenuous. We don't have such a strong body of research to say about that. And if you look at the human literature, there's a lot of argument as to how important posture is in relation to pain. But I think if we think about the horse and again the rider and what we're asking of it, it makes a lot of sense that we need to have good core stability, good posture, and then they can they can cope with the demands that we put on them.
Yeah, I agree with you. It's a very interesting thing to think about, and we often as therapists, I think we have a tendency to focus on working on the horse statically in front of us. So we'll go in, treat them, look at their bodies, and we're treating the whole body. We're working with the horse as a whole, but we are not always taking that into movement and retraining movement. So the moment there's a dysfunction, these postural stabilizers are deactivated, or the recruitment patterns change, and when they've changed, they don't necessarily change back when the pain is resolved, and that just ends in a spiral, spiral of furthering dysfunction. So really targeting that retraining of neural firing and muscle recruitment, etc., is so important. And Tulia Luamala actually hinted to that, or spoke very briefly about that in the fascia series episode last week. That muscles will work as they can, not as they should. So when there is a dysfunction, you'll have your muscles activating in whatever way they can in that moment, and not the way that they should be. So we need to be thinking about that. Hi, Caroline. It's so great to see you from Ireland. Thank you for joining us.
I think actually to add to that, clinically, when we are assessing our patients, our horse is in front of us, and we have that hypertonicity of longissimus and we have that pain response on palpation, I think that it does actually show us, you have to think, well, why is this muscle overworking? Why is it painful? And that is usually because it's trying to work in a functional pattern that it's not actually designed for. We know that the fiber types of longissimus is not supposed to be working as an endurance stabilizer. So that muscle then is dysfunctional when it's working. And we need to think about the core muscles, the core strength and the hypertrophy of those underneath stabilizers. Because if we just go in and address that hypertonicity, we can go in and we can do all the soft tissues we like and the techniques in the world that we like. We can make it all soft and fluffy and gooey and lovely and like brie, as I describe my palpation scale. But unless we actually try and resolve the dysfunction underneath it, then we're not going to get anywhere.
Yeah, and the opposite again is true. We can try and resolve the dysfunction, but if we don't bring it into movement,
exactly,
it's not going to remain resolved. We'll just continue in a spiral. So it's an interesting thing to think about, and often I'm like, if every patient I go to has painful lumbar musculature, then this becomes normal, and then we stop thinking about it, and it's not normal. So what is going on?
Well, obviously the demands and the load placed on the system exceeds its capacity to tolerate it. And I think that if you think about that capacity model, that is how we think about tendinopathies in people, or any kind of pain sensitivity. We need to try and work out what is our limiting factor. And if you say, if we've got that stiffness and pain in the lumbar region, why is the horse moving in that way to create that pain? Now, obviously, from a physiotherapy point of view, I'm not diagnosing what's going on, but I know, again, from the literature, that back pain is commonly secondary. And so long as we think about that and looking for lameness and excluding that, and then referring that to our veterinary colleagues for management, then we can start to think, okay, so what is it about the movement pattern of that horse that might be creating this requirement for them generating stability by themselves in the, effectively, I don't like to say the wrong place, but in an area that actually isn't going to functionally help them, because we need movement through there, we need flexion and extension. And then that's when we need to be quite critical of our movement patterns. And as you said, knowing what's happening dynamically is then critical to actually being able to unravel it.
Back pain is a very interesting thing. There's research that says about 50% is primary and about 50% is secondary. Do you think, is that more or less what you find in clinic? Do you think?
Yeah, well, it's the definition of secondary. I think it's always secondary to something. And there's obviously, if you've got saddle foot issues, or they've gone and gone over a fence or something like that, then that's primary. But I think it's always coming from somewhere, and just treating that in isolation isn't going to give you very good outcomes. From a short-term perspective, you'll make them more comfortable, but actually, as I said, it's unraveling, it's problem solving, getting to the bottom of it, and then dealing with that. And that may be including manual therapies, it may be including electrotherapies, but it definitely should include education and advice on exercise. So even if you aren't qualified or skilled enough to be able to progress that horse's exercise from our more standard physiotherapy more static, our weighted activation exercises or our weight shifting, that kind of thing. It's actually getting the client on board with knowing what they need to do to progress and get back to more of a functional movement pattern, and getting them back on board, and actually both of them being happy, the horse and the rider.
Yeah, I think that raises a very interesting point. You've just said that if we feel skilled enough, and I think that like with dogs, it's quite easy. The exercises are quite easy for us to do as lay trainers, because that's not our area of expertise, right? But with horses, if you want to train good posture, you really have to know how to train good posture in movement. So it's not quite as easy. And for many of us, like, using gadgets is the easy way, right? Like using a Pessoa, or I quite like a neck stretcher. That is my preferred gadget if I have to use one. Do you know a neck stretcher?
No, that's not a term I'm familiar with.
It's very simple. It's elasticated throughout the length, and it comes from it has a point at the top. The middle point is at the top of the pole, and you can shorten and lengthen it from there. And then it comes down the cheek pieces into it, and then to the single, wherever you want to attach it. So it really is very, very soft, and it just it releases as soon as they just drop their pole. So that's the one I prefer, because it isn't it's not forcing them into a position. It's very soft.
We call that just an elastic bungee in the UK. But I am not for or against training aids. I'm for them being used correctly in terms of ethically for the horse, and the horse has to learn and know about pressure and release. So one of the other areas that I have explored quite a lot is equitation science and the application of learning theory, and the knowing how horses respond to training aids and pressure is something that interests me quite a lot. But yes, you're right, that the snapping on a training aid isn't either the answer, but then, as you said, trying to get somebody that is trained in it. I mean, I suppose one of the things with this lockdown and the explosion of online courses, there is so much that people and owners can do. I am a huge fan of in-hand work, and there are so many courses on in-hand work correctly. And I don't mean stand in the middle and get your horse spinning around you on the lunge. No, I mean actually close at hand work, more traditional classical education. That is so good for being in a position to analyze the horse's movement patterns, being able to place them where you want to, trying to get the the right movement pattern through the back, through the neck, and through the limbs. And that, I would really urge people to go down that route if they want to learn more about how to progress out of the stable before getting on a rider.
I agree with you. For my own horses as well, I think 90% of the work that I do is actually in hand. So groundwork type of work in hand on the, with 2 reins short, and like maybe 5% lunging and like 5% riding.
It's a really good stepping point. And when you see what people can do with their horse in hand, some people look down your nose and go, oh, you should get on your horse. But when you can see what people can do, you can, my own horses, we can shoulder in, we can half pass, we can travers, we can pirouette in hand. So we can explore quite a lot of movement patterns without having to be on top of them.
And I feel like it might be easier to get good quality movement from the ground than it is under saddle, because for sure, like adjusting my body and how the horse is responding is a little bit easier when I'm on my own 2 feet than it is when I'm in the saddle trying to control all those different aspects, and every change, shift and balance affects my horse. So I'd love to hear from you guys. What are you using? How do you use exercise in your patients? How do you encourage owners to use exercise? Are there specific are there specific kind of training courses that you advise them to take? For example, for me, my favorite would probably be straightness training, in terms of the resources that they have and the ease with which you can learn it, and the quality of what they're getting. So that would be my first one that I'm referring clients to if they want to learn more about that. What do you guys use? Obviously, that's also regional where you are in your area. There are different, you have access to different resources. Training aids as well. Let me know what you guys think, use, don't use there. I know that's a little bit of a
Well,
yeah.
I'm quite happy to jump in on the training aids idea.
Yeah.
I mean, I was always a fan of the Pessoa, and probably for the first decade of work, it was literally anybody that was rehabbing their horse. Here you go, here's a Pessoa program, and off you go. And that was because at that time, I didn't know any better, but I've evolved my thinking, and I've looked at the literature and looked at it quite critically. And I am actually a fan of separating the forehand and the hindquarters of any training aid for the horse, because I just feel that we have a little bit of an issue with what we're trying to achieve. So if we want the horse to go in a longer, more open frame, so with the Pessoa, or we talk about that neck posture where we want a horizontal top line, so the ear level with the withers, because then we know that we haven't got any increased extension on the lower cervical facet joints. We want more of an open mandible atlas angle, don't we? Want them slightly in front of the vertical. And I just find with the Pessoa, when they try and go into that position, if you've got it tight enough so that it stops them coming up against they come up above the vertical, I find that then you end up with tension in the hindquarters. And then if the horse takes a long stride, then they can get punished in the mouth because of the rope around their bottom. So we want both factors. I just don't like it connected in the middle. So actually what I do is I take my clients' Pessoas and undo all the knots and then connect them onto the roller in the middle and then just have a fiddle with it. So we want the hindquarter strap, don't we? We know about how, that proprioceptive facilitation from behind. So we know with our equibands, we want them to recruit the flexors, the hypaxia muscles to step under their body, but let's not punish them in front for what's happening behind. And my training aid of choice in front is actually the Chambon, because the Chambon goes from the girth, it goes up to the ears through just through a loop and onto the bit. And what we then have is the ability for the horse to raise their head up, comes up against pressure, and then it drops the if it drops the head, then the pressure just goes off completely, and it's able to move its nose forward away from its chest. And I know that that's not a posture that we necessarily want if we're going to go into an dressage arena, but in terms of rehab and in terms of that variation in training and then being able to have a different posture when they're ridden to when their head is, when you're rehabbing them on the lunge, I like it. So, I recommend the Equiband, or if we want to have a hindquarter activation, and then the Chambon in front as well.
I like it. I also love the Equiband system, and I will often use body wraps in a similar configuration. It's much softer. I'm not getting any resistance, but there's that proprioceptive feedback. We have some comments. So from Maria, as a client owner, I've benefited greatly from Gillian Tabor's recent online course, which includes exercises done with the horse in the stable. I like that. You'll have to tell us about that, Gillian. I've done in-hand work, straightness training for many years, but these static postural exercises have been a real revelation for me. They're making a big difference to my horses. Maria, that's amazing. I also find that with my own horses that I use straightness training, I'm doing a lot of reflex activation, static core strengthening as well, and they just help each other so much. Gillian, will you tell us a bit about your course and about what exercises are you including and teaching in that?
Yeah, so the course is really a combination of all the advice that I give my clients, and I wanted to try and share it a little bit further. So that's gone onto a platform that people can access, and it starts with foundation exercises in the stable-based exercises, and it's really difficult, isn't it? We call them static exercises, but they're not static at all. The horse is standing, but what we're doing is, in a very low intensity manner, we're activating those core muscles, and we know that really is the starting point to trying to get them to work, because we know about their muscle fiber type being type 1 fibers that respond to this sort of low intensity regular exercise. So if we can do these kind of exercises frequently, then they're going to benefit our horse when we do start to move it more dynamically. So in the stable, the exercises on the course, I've got quite a good description, I think, of the carrot stretches. Now everybody knows those, so the dynamic activation ones. But we've got some weight shifting exercises. We've got so with a rocking hindquarter rocking, using the tail to facilitate those. And then we've got some balance exercises, and we've also got those reflex activation exercises. So that's really, the starting point for anybody with their horse. And the good thing about those is those can be done with horses on box rest. And I think that they are really important. So you've got if you've got a horse on a box rest for lameness, you can carry on doing these exercises without fear of compromising. If you've got a tendinopathy or, a joint issue, you can do these exercises. They're obviously going to be critical if your horse has had any kind of spinal surgery, either the ligament snip or the bone reshaping. We can start these relatively early on in their rehab, just to try and ensure that we're not losing too much of what we had, but trying to build them up ready for when we get them out of the stable. So then the exercises will they progress through the program to in-hand exercises, and then the more dynamic exercises in a more arena based form. But you don't need to have an arena for them. You can do them wherever you are, corner of the field, out and about hacking in hand with your horses. That's another thing that I should say that I'm really pro of, taking your horse out in hand. And oh my goodness me, I've been brought up with the British Horse Society and Pony Club and saying, you should never get off your pony, that's teaching it the wrong thing. Absolute rot. Get down on the ground next to it, and you can really assess what's happening. You can get some really good quality of movement. So yeah, there was a comment here from Eloise about clients that are reluctant to do them. I think the trick is trying to sell even just a minute or two of them. So if they don't want to do them, how about getting them, they're tacked up, ready to ride. What about just doing a few in-hand circles, getting them to move their feet across, getting them to flex and bend through their body? If they are athletes themselves, or, maybe not an athlete, but maybe they exercise, perhaps key into their thoughts about warm up from themselves, think about improving performance, or look at some of the more advanced work and see. One of the people that's doing quite a lot online now is Tristan Tucker, and he does a lot of in-hand work with all his horses, and he's riding at Grand Prix dressage. So they're not just for people that are scared for riding their horses, which is sometimes I hear, or people that are faffing around with their horse on the ground. That's not what it's for. It's actually postural activation. It's a warm up. It's making the most of your horse before you sit on it. So good luck trying to sell them, but I think it's a cultural thing.
I think I could add to that another thing that you could tell them or try and convince them of to get them to do it, is that it's like a test for your horse. So you're testing their mobility, testing their movement. So you can see from the ground, is he stepping shorter? Is he a little bit stiff? Like, can he bend properly? So that's something that I'm bringing from kind of canine athletes in the chats that we've had there. Is your warm up is about testing and checking and looking for any asymmetries, changes. And the more regularly you do that, the better you get to know your own animal, your own horse or dog. And then you're very quick to pick up, he's not bending easily to the left today, something's wrong. And it kind of guides you as well then when you get on and you start working. What are you going to focus on? What are you going to be working on? So that could be a really good way to try and get owners to include and incorporate that. And I also think, just like you've said, they need to see it from other competitive riders, or from other people. Your clients might not be competitive, so it might not be what they're looking for. But the more they see people working from the ground, the more it starts to break that cultural barrier, like you've said, and then the more they will be open to it. So I think that we should posting more pictures of ourselves working our horses from the ground on social media, so that it becomes more normal and more accepted.
Completely.
Jennifer has a comment here. Is there research on rates of problem or injury prevention or improved performance of doing in-hand or dynamic activation, weight shifting, balance, reflex exercises rather than as a treatment? I suspect this would be very difficult to do.
Yes, completely. The difficulty with that is actually the measurement of outcomes, and that's actually what my doctorate was all about. And it would be exceptionally difficult to do. I think I haven't got an answer for that. No, there isn't any research. There's a lovely paper that's published last year. Ellis and King did a study looking at the use of these postural exercises as part of a rehabilitation program. And they did find that they reduced the postural sway of the horses. The study was lovely. The only part of it that does limit our extrapolation of that information was that they also included using the Equiband and water treadmill as part of it. So I am very keen, and actually my job at Hartbury is quite good because I have rather engaged students that want to study these things. So we do have a few projects underway that might in the future be able to answer some of these questions. So I've just watched this space. It is an area that does need research, and I think once we do have it, it'll almost sort of fill in that missing link that we've got from pain pathology, altered movement, to actually how they then work in a normal population as well.
I'm not familiar with that research paper. Who did you say it was by?
Ellis and King. So Melissa King, and she is at the University of Tennessee, I believe. She works a lot with Kevin Hounsler. And so in their paper, they followed horses through a rehabilitation protocol. And these horses were at the yard for lameness pathologies. And then they looked at their postural sway. So they put them on force plates and they measured their center of pressure movement. So any of you that have, this is like showing my age, but a Nintendo Wii balance board, you used to stand on it and it had a little red dot, and you used to see how much it wiggled around. And we know in humans, those with poor postural sway have a larger area that dot draws a line, and they move faster. And in those patients, they're more likely to be at risk of falls if they're elderly patients. So we work on trying to reduce their postural sway, and that is then a proxy for increasing core stability. So in these horses, they put them on the force plate and they measured them before and they measured them after, and the area of the center of pressure movement reduced and the speed reduced as well. And also, their multifidus cross-sectional area increased through the program of rehabilitation as well. And so it was quite a nice link between increasing multifidus and improving the core stability and the postural sway. And what I quite liked about the study as well is they used the pads, the pads that you put their feet on as part of their rehab, and they measured them on the force plate on those foam pads, and that was also shown that they had a reduced postural sway as well. I mean, it's like, there wasn't a control group and there's low numbers, and from a sort of critical evaluation point of view, there's things that I can pick out, but it's brilliant that somebody's out there and they're measuring these things and actually demonstrating that we can have an effect. So if anybody wants to do any research, anybody's looking for a PhD, I should do a bit of a plug for Hartpury University. We do take PhD students, and we do take international PhD students. So if you want to come along and join us furthering the research on this, then please do.
I love that. I love that. One of our big goals this year as Online Pet Health is to encourage you guys to do clinical research as much as possible. So really focusing on like, what can you do in clinic? Like, what can you?
Oh, I've got a brilliant idea straight away. So the one thing that you need to do, and I know we're talking about dynamic posture, but have a look at static posture. So we had a small study, we had 70 horses where we measured their posture from a photograph, and we found that there was a relationship between posture and those that were grouped as horses with back pain. So all we did, and it was so simple, is we took a picture of the horse standing square, head in neutral, so the chin of the horse level with the point of the shoulder, and we measured an angle from the highest point of the withers to the lowest point of the back, the highest point of the pelvis, and then to the tail head. And you can do that with free software. You can just download that, on your phone or on the internet from a photograph, and then just measure. And we recently published a paper where one of my students and we actually used a flexi curve to measure the sagittal posture, so the side-on shape of the horse. We did baited stretches with that horse, and an hour later remeasured them, and we found actually that they had a higher back, so they were in more flexion an hour later, so that was statistically significant, and our effect sizes showed that we were clinically significant as well. And then 24 hours later, we found that we were also still elevated, not statistically significant, but there was still a lift in the back compared with a control group. So just by measuring that posture, you could perhaps keep a track of your treatment outcomes. So long as you are standardized in your standing position, and you take them the same sort of stage, either before exercise or always after exercise, for instance, use that to take some measurements and record, and we can get a little bit of clinical science going. And as Ana's saying, well, it'll be really interesting to see before and after pictures.
So can people email you if they want to get involved?
Of course. Yes. So you kindly put up my website link. So if you go to that, then you can contact me. There's a contact form on there. There's also links to the course on there. There's an email mailing list, but my email is just physio@gilliantabor.co.uk. You can also find me on my Hartpury. So if you type in my name and Hartpury, then my research profile will come up as well, so you can see the kind of things that we've been looking at and working on and publishing. So I'm really, really keen to support my students in doing practical projects and getting those papers out there. And it's really exciting to actually have something that's clinically relevant. And I'm all about simple, inexpensive, objective measurement as well. And so, yes, it's exciting to have 3D kinematic analysis and ultrasound and force plates, and I get very excited about that. But on my day-to-day job, when I'm standing in a field in Devon, I don't have those. So anything that we can do with our phones or with relatively inexpensive gadgets, then I'm all for that as well.
I agree. We do need that research that's high tech and giving us the little details, those details of information, but we also need research that's going to be applicable in the field, that we can take out with us and say, this is what we're going to do. If you guys looked at yesterday's research refresh, it was about tail pulls, and reading that, my mind, they effectively, in 100% of the horses, reduced the pain threshold in the back and in the hind quarter. 100% of horses had a reduced pain threshold after doing really simple tail pulls. They had really low pressure applied, so not like hanging on the tail and applying a lot of pressure. It was really little. So yeah, that's the kind of thing we need. That's what we need. This works.
Yeah.
Do this works. Give this to your owners. It works. It makes a difference. And again, taking that into movement and into exercise, what are the things that work that the simple person, the me's in the world who are not trained and qualified trainers, can apply and can do and can learn and can be successful with. So yeah, I think that's so important. We do also, on the topic of research, have a research group. At the moment, there are more small animal people in that group than equine people, but we're trying to get more equine guys on board. And basically, the idea behind it is, how can we work together and collaborate on getting clinical research out there? So not all of us are in a position where we can be easily linked to a university, but maybe Hartbury is that solution. I don't know yet. But it's about, let's talk to each other, let's come up with ideas, how can we execute them, and and work together, more heads together, trying to solve one problem. So if you guys want to know about that group or join that group, I'm going to try and convince Gillian to join that group as soon as we're done. Then you can just pop me an email, and I'll put my email in here as well now, and then I'll have you added to that. Okay.
Sounds brilliant. Actually, no, you don't have to convince me. I mean, I think one of the things that you, through the research journey, you learn how much there is to learn and how exciting it is. So yeah, there's so much more to it. And as you said, more heads on it, the better outcome we're going to get. And actually, sounds a bit, but to actually the ultimate aim is to benefit the horses, and the more we can share, the happier horses we're going to have, because we really need to help them. These horses work so hard for us, and a lot of them are very stoic and are very tolerant. And yeah, I'm all about thinking about what's in it for the horse. And one of the things that we should be doing is being an advocate for the horse. And the more research we have to show what's going on and how we can improve their quality of lives, then yeah, definitely we need to go down that route.
I agree with you. That's the most important why behind everything we do, is how can we help them have better lives. Yeah, they work so hard for us. And for me, the other part of it is, so many of us struggle with recognition in our field, within the multidisciplinary team. And one of the ways that we will address that is by validating what we do, by having research that validates what we do. It's one of the languages that vets understand, so it is one that we need to use. So yeah, really important. We have been going on for really long, guys, so I want to ask you last questions. I have a list of questions here, and I'm going to be honest with you, I've asked one. So do you guys have any more questions or comments? If you're watching this as a recording, feel free to ask questions. We will come back and answer them, either myself or Gillian. Feel free to chat with us, interact with us, let us know your thoughts. And I look forward to hearing from all of you. Thank you so much, Jill, for joining us.
Oh, thank you for having me. And yeah, put any comments down and I'll come back and check, and then I can answer them. And do feel free to get in touch. I'm quite happy to talk about horses.
Horses and research. I love it.
Yes. Yeah.
All right, guys. Have a great day. Bye.
Bye.